The system of its management must be so sorted and never politically dependent. That should be the last thing. So you do get certain people who are imposed in public sector who shouldn't be imposed, except that some people recommended them, not for our lives. And that's my point. You know, I'm talking of the hospital level. I'm not even talking about ministerial and all those DG, and that's not my problem. My problem is the people who, when we are sick, we go to meet, help us, sir, medical director. And he doesn't even understand his left from his right. God forbid.
So Dr. Wada, thank you so much for having us and to host this conversation at your place. You're welcome to another special edition of the Curated Conversation. It's a conversation hosted by Nigeria Health Watch to get insights of what's working and lessons and recommendations on global health issues. It's a pleasure to have this conversation with you. We are at the forefront of one of the most referenced public-private partnerships within the health sector and in Nigeria. Could you tell us about your vision? What led you to venture into that kind of investment? And what were you trying to solve? And what also did you see at the time?
Right. Thank you very much. I'm delighted to be here with you. And let me start by appreciating the role that Health Watch is playing in the discourse regarding the Nigerian health system. I am the chief executive of the Nisa Premier Group that have managed Garki for the last 18 years, from very, very low levels where we met it to what has now become a sought-after medical center that's inciting discussions across across sections of our community and even outside Nigeria. It's a very touching story and very dear to my heart, and I'm very pleased to be here to share it. What are the issues? One is, at the time of Nigeria's independence, this was one of the best destinations. People were coming here to seek medical care at Ibadan, for sure. Even from Saudi Arabia, we heard that important people were coming to Nigeria to seek help. And gradually, our country descended onto the lowest of the low. If you want to talk about health indices, what is life expectancy, how many women die trying to have babies, how many children die helplessly, you need to look at the bottom of the table of the world to find Nigeria. What that means is, one way or another, we've not done well globally. And most of our centers are public centers. I witnessed the decline of UCH Ibadan, Zaria, Lagos, and you start wondering, couldn't we as a people look for a different way to do things? So I think that gives you a background. Our people did not trust our healthcare system. Too many challenges were existing. You know that this is one of the places on earth where, the relationship between the government and the health workers breaks down. Too often they're on strike, and, basic amenities and supplies like electricity were difficult. And the results were not good. So when the opportunity came that the government or the administration of the Federal Capital Territory wanted to experiment, pilot a public-private partnership PPP program, eventually we showed interest, not because we thought we would get it, but we believed in the idea. We knew there was sacrifice to be made if we were ever to be selected. So one thing that I'm very proud of is that was one of the most transparent processes you could ever lay your hands on in this country. The procurement of the Garki Hospital Public-Private Partnership, 2007. Clean. We didn't expect to win. We didn't lobby. We didn't try, because we knew this is not a money pot. This is a sacrifice pot to prove an idea that could power Nigeria to a better, health pathway. Yeah. So, but we won, and I'm like, what? How are we going to do this now? Because the hospital is run down, been closed 6 years, and the only patients there were rats and lizards for 6 years.
My goodness.
The government tried to renovate, but it became too complicated. They couldn't do. So whoever was going to win this PPP had to be ready to renovate the hospital and make it work. I haven't given you the background. The next thing is clean process. The next thing is what did we meet on ground? Very important. Dilapidated half. We had to rewire the hospital. We had to make flow, because what we saw was clumsy at best. You couldn't do a mid-level or high-level medical practice in the environment we met. So we had studied it as part of our submission. We knew there was engineering work to do. There was conquering the environment to give the kind of quality to the patient that we had in mind. And so when we won it, and that was during the period of President Obasanjo and Nasir El-Rufai, we knew we had to roll our sleeves up and get work. And we did, because somebody, somewhere, some group needed to prove that not all public hospitals needed to go down the way most of our teaching hospitals, general hospitals had gone. So we created that semblance of a modern hospital environment. I would call it clinical development stage 1. Get the hospital ready to make sure nobody can die needlessly. We achieved that. And we then progressively ran what I call a very efficient general hospital system. That was our clinical development plan. It was a 15-year program of PPP. The first one is build a foundation of care that most of the general illnesses can be cured. Cesarean for those who are in labor and they have difficulties, hernias, operations, medical treatments of things like diabetes and so on. So we laid what I call a very strong foundation for the first 5 years. They say about the money, this program had provision for poor people, indigents we call them. This program was heavily weighed in favor of the national health insurance system. From these two words, you will know that it's not a money pot. It's not a business cycle where you're going to say, what's my bottom line? For us, the bottom line is, was this idea working? We were foreigners. We were people that if we succeeded, other parts of the country will wake up and say, what? They can do this? And you come to a general hospital, everything is computerized. So that was objective number 1. So for the first 5 years, we were pouring in investment. We were pouring in, we were buying MRIs, we were buying CT scans, all X-ray equipment. We were doing this, we were doing that, setting up a good pharmacy that will flow, and labs and so on. So we beat our chest after 5 years that this is a general hospital of the highest possible standards, comparable to any public general hospital. So we clapped for ourselves and sat down. Clinical development number 2, what do we do next? We started saying to ourselves, can we try and battle to bring to Nigeria the kind of things that will send Nigerians out of this country anyway? That was the thinking. So we set ourselves the goal. Another 5 years, we wanted to be able to do stuff like kidney transplantation, open heart surgery, do in vitro fertilization, so-called test tube babies within the government system. Now, many places had attempted this and failed, under the government auspices. If not, why were people then going out of the country? So we embarked on the next phase. Again, highly capital intensive. I've not talked about quality of doctors, pay of doctors, nurses, and so on. But it needed more cash investment. That's when we knew that if this public-private partnership will succeed, we will be out of pocket at the end of 15 years, not in pocket. We're not talking profit. We're talking ideas growing, but we use money to grow those ideas. So what's going to happen to us then? And we started writing the government. Look at, you are part of us. You can see, we audit the thing every year. You're this, you're that. The way the graph is going, you know that 50 years is not enough. And we now started reminding them that even the World Health recommendations about public-private partnerships, being a social public-private partnership, social PPP, meant you minimum was 25 years because A, you are heavily investing, you are bringing in good personnel, paying them well to run it differently from a government general hospital. You cannot make money overnight. And that's when the problem started. They will not reply to us. They will not engage us to discuss this. And so we drove this to the next part. And that was, the investment was too heavy already. Are we going to just then put all this equipment, what are we putting back in society? Yeah, that's when the training of doctors started. We were doing high-level medicine already. Open heart succeeded. Kidney transplantation succeeded. Test tube babies were being born in a government PPP general hospital. And so are we not going to train with all these things happening? So we embarked on residency training to produce specialists for the country, which has its own cost element as well. So we are helping the indigent. You are training medical personnel that are not necessarily going to serve us. They were free to go and serve in Enugu or Bayelsa or somewhere as consultants now. We've trained more than 60 consultants to date in different specialties like gynecologists, pediatricians, physicians, and all that. They are in society. So that's another currency of the public-private partnership. We are not shy of what any public center could do in terms of the number of people that we produced as specialists. Not to talk of intern doctors, intern nurses, intern lab scientists, pharmacists. So we were also present as the general hospital to go to, one, because it was within affordability. You cannot find parking space. And that's the Nigerians are speaking. If there's quality, they are ready to pursue that quality. You have to train the people. You have to do the indigent. You see, the numbers are not adding up in terms of business ideas. So we went on and pushed. And that's where the crisis you referred to came. We said, oh, you must pack out and go. But for the last 5 years, we've been writing you. We even involved the ICRC, which is the regulatory body, and said, look at our numbers. We're not supposed to lose. We're helping the country. The bottom line is good health-wise and patient satisfaction-wise. Data-wise, we are good. Finance-wise, it is not looking so good.
It wasn't profitable.
We need extension. Because we've laid the ground for profitability. But like any hospital, it took so long. No social PPP can be 15 years. Experimentation, yes, but we deserve at least some more years, even if it's 10, during which we should be able to recoup from our investment, even if we didn't have much profit to take home. But the real profit we want is, this is truthful, this is well managed. The world is saying it, not just us. World Bank is saying the same. Many other governments from outside the country have visited Garki Hospital to say, what is it that you guys are doing that we are seeing results? Yeah, and we are hearing good stories. The Kwara State government came, Cross River came, at least when I was directly involved, and people came from Sierra Leone. ICRC marks Garki Hospital as an exemplary, honest, transparent PPP. So there we were, and the battle started, which is what you also asked me about. I said, what happened? When something is successful, people just assume it's a mint. You change it, you crash it again, and Nigeria loses. So we reminded the government of that day, not today's one, that people's lives are hooked onto our machines. Are we going to just switch it off on the date you gave us and let them die? Or This is Dr. X that is looking after this cardiac patient. You just transfer the care overnight. What about people who have been seeing these doctors for the last how many years? There must be a slow and steady thing. And hey, guys, we've been writing you. We don't own the hospital. Yes, we signed for 15 years. We are supposed to go, but there's a method to that madness. There's a method of going that doesn't harm life. So the last thing I could do for this country would be to walk away, crash the success that had been built with sacrifice over 15 years without even an argument, because government has all the power. It wouldn't be fair to the public. It definitely will not be fair to the Nisa Medical Group. And it is true what I've told you, that it was step-by-step sacrifice to get what is looking so like a beautiful bride other people want it. But even if other people want it or wanted it, there must be a way of transferring. So we are not harmed. The public is not harmed. The government is not harmed. Everybody is smiling and saying, well done, you've made a point. We're going to take it over from here. It's not ours, so we're fine with it. What has brought our nation down consistently is that inconsistency. Consistent inconsistency will definitely make you not climb over the life index. So when you hear, oh, there was dispute, oh, the grace of God turned the tide. The government had changed. We now have renewed hope, if I may use the word that politicians use. And that renewed hope meant come and sit down. What's been going on? Where are you? What's the interest of the public first? They wanted to engage us on that. And that made it a win-win for everybody. So there was a renewal of the public, of the PPP for another 15 years. And who is benefiting now is the public. Doctors are on strike as we sit. Are you saying Garki would have been closed? What would have been the hope of the public person? Where would they have gone? You see, my tag for Garki Hospital is the poor man's private hospital. That's how I call it. It's everybody's private hospital without having to dig too deep in your pocket. So, but having said that, I am happy I'm alive, that we've made sacrifices, but we can see light at the end of the tunnel now. It's reset. We are going to go to the next phase. That is build an environment that whoever walks in there knows these are serious managers. An environment like nowhere, no public hospital can come and challenge us in terms of the quality of that environment. Build a flow of service that no public hospital can challenge us. Yeah? And of course, advanced medicine. Train the people. We've not been lazy. We've paid the salaries of doctors we are training for the communities. We've not said, oh, come and pay school fees to us so that we can train you as gynecologists. We employ them, pay them equivalent or higher than what the government hospitals will pay. And yet they get their certificate, they shake my hands, and off they go. We've added value beyond money to this country, and we're happy about it.
Wow, that's a very beautiful account and walk down memory lane, Dr. Wada. It's you touched across so many things that we can possibly have a conversation about. But I think I'll just start very quickly from the part of affordability, because things are quite. We live in a time where the economy, as a lot of people say, is quite tight, and it seems that you also have that concern. You are very interested in putting the public interest first. I like that you also refer to it as the poor man's hospital. So let's dive a bit deeper into that.
Yes.
To know what was your strategy to ensure its affordability and access for the average man, and also what can the government do? What policy levers must the government put in place to ensure the sustainability of that affordability and access for the average man of such PPPs?
You see, let's start from what other people have already done. That if you're a citizen of that country, you go to bed sound. If you have a headache, you're not worried about your pocket. If you need a hernia surgery or cesarean, you're not worried about your pocket. What is the name of that game? Health insurance. For some reason, since independence, we've been struggling to. We know the truth. There is no general hospital you can visit in the United Kingdom as a citizen and afford it, except that everybody is pouring health money into a pot, which is insurance, so that whichever one amongst us is needing it will dig into that, but to get the best beyond their own personal limits. That's what health insurance is all about. Ask yourself the question, does Nigeria not have enough people who can deliver to them a satisfactory health insurance system for their 200 and something million population? Answer is yes, they have. If not, how come they have Access Bank, Zenith Bank, this one bank, and they're covering the whole population? What about Ep.10? And they're covering the whole population. You see, I don't want to say too much. Those places were run by government before government bank. I was alive when the government owned banks. I was alive when telecom was not Nitel, it had a name, P&T or something. How efficient were they? But when they gave it out to the private sector to run, it went wild. Today, making a call in Nigeria is the same as making a call in London. Why mustn't the insurance system be so deregulated? This is all we own, our health. What you call it, Ep.10 is a comfort. And T2, which used to be 9 Mobile, is also there. And I'm very happy to mention that. It's not just Ep.10, there's Glow, there's this. How come we can do that? But when it comes to what keeps us alive with vitality, we are living it at a slow pace. My appeal through you to the authorities and to the world, release Nigerian health. We are at the bottom of the pit. Yes, there's movement, don't get me wrong, but it's too little, hopefully not too late for most of us. It is time, the time has come. If Garki Hospital is to be honored as an example of a hospital that has been in private hands for the last 18 years and is a beautiful bride, the story, if it was in the hands of government, after 18 years or 20 years, is no longer a beautiful bride. That's why Garki was closed for 6 years. It had run itself so badly down that nobody could go there anymore. To stop it, let's try and renovate. Let's see what else we can do with it. That should be the story for all our hospitals. That should be the story for access to healthcare. It must never depend on whether you are poor or rich. The basic system, including your heart, your brain, every part of you, must be such that we are each other's brothers' keepers. When we are well, we chip in so that those who are sick, who may not afford or something, they are our brothers. They are our genes. They can tap into that insurance fund. Oh God, bring a day when this becomes like the banking sector or the telecom sector or any of the moving sectors, even aviation. Did Nigeria Airways run down? Where is Nigeria Airways today? They deregulated it. Now your FPs is going to everywhere in the world. I'm sorry I'm talking too much, but at my age, if I cannot advise that, then I'm not worth. I've not made the sacrifice of Garki, and I didn't learn from it. Garki should be a shining example of the next steps that we as a people must take to protect our health and to grant us some longevity. You know, our longevity is almost 30 years below some top countries. Why?
Yeah.
Why? Time is now.
Yes. I'm glad that you emphasized on this PPPs model to really shape health outcomes. Yeah. What would you say is the governance model, the recommended or ideal governance model to maximize the impact of such PPPs?
We have a model that can be used. So it's owned by the government. It's operated by the private. The top level of governance is the board. Yes or no?
Yes.
Normally, the best chairman of such a place has public and private experience. So he's not thinking everything must be done about government, the way bureaucracy works. So we have that in place. So we have chairman of board and board members from different walks of life, including representatives mixed with government people, FCT that is, and private people and lay people, from the public so that public interest is protected in many ways. Then the management of that must be left now to merit-driven management. So if you are medical director of such a place, you should be a medical director, not chosen because you are this or that is supporting you, or that person is not supporting you. Yeah. So the management thing is set, and the other lower level managers are also tasked. It should run on objective-driven management, so-called management by objective. So if you are heading gynecology, for example, we have approximate targets that you must meet, not in numbers or money as much as clinical results. So women cannot just come, have a baby and die needlessly. So there's responsibility. And I think that's the kind of structure that if it's copied and pasted around the country, it should not take us more than 5-6 years to start saying Nigeria too has changed, just like Ep.10 changed. Because no point doing health insurance if you are going to have the dead hospital for the people to go to. You are deceiving yourself. And you are taking the people's money and misusing it, misapplying it. Sorry, your person this. Sorry, we didn't have that. So you're right. The system of its management must be so sorted and never politically dependent. That should be the last thing. So we want to appoint an MD for Garki, and we advertise. We're not going to take the list to somebody to politically balance it to sign it. That's a win for us. So you do get certain people who are imposed in public sector who shouldn't be imposed, except that some people recommended them. Not for our lives. And that's my point. For our lives, that's not accepted. For other, I'm talking of the hospital level. I'm not even talking about ministerial and all those DG, and that's not my problem. My problem is the people who, when we are sick, we go to meet. Help us, sir, medical director. And he doesn't even understand his left from his right. God forbid. All right?
Right. So. Just very recently, we had a conference I was telling you about. It's called the Solutions Journalism Africa Initiative. We had a partnership with an organization. We partner on this, the Solutions Journalism Network. It's basically the understanding that we tell a lot of negative stories. There's a lot of negative stories in the press, and that there's a need to, consistently reframe Africa's narratives, and narratives basically shift focus a bit from just stopping at the issues, but also taking it a step further
to the solution.
To the solutions, right? And this is a classic example
Absolutely.
of that. So I from our perspective, these are things that we focus on.
You can focus on that anytime you want.
Absolutely.
I'll take you to the lab. We should do this interview there.
Okay, that would be very much welcome and interesting. I know that we are quite, time is
fast spent.
Yeah, and we could have this conversation all day long and still not talk enough about it.
Yeah.
A wrap-up question would be, what is your perspective of successful PPPs that you'd like to see? What would you like to see done to scale such successes and ensure its sustainability?
I like to see more of government interest in PPP, because if it's happening everywhere, it increases the competition environment, and it makes everybody aware in the public. Of course, it will have limitations, but what is good about it is more than what is bad about it. That's number one. Number two is, as it is going on, the government must adopt her full responsibilities for regulation and ensuring compliance. That's what governments are all about. They mustn't deliver the healthcare by themselves. That will also help it to sustain, because this kind of, they are minting money, it's unrealistic. But if government is inside it with the regulators checking, clinical successes, financial successes, and so on, then whatever the negative people are saying, the facts on the ground will help the government to propagate and preach PPP. And always remember the dark days of telecommunications, the dark days of this, and so on, which we hope will also come to the bright days of health and bright days of electricity and all that, which I can see that coming very, very soon. Health is wealth. no matter how rich we are as a people or as a nation, unless we correct the health indices we are having, we will be compared to the poorest of the poor. So those are the things I think government can do to sustain it. Access must never be by affordability. People must be able to proudly go to a center, primary care center, secondary care center through referral. It must flow. Not that you wake up one day and say, I'm going to Garki Hospital. No, there must be a system that you have a doctor close to where you live who knows your family, who knows about you, and say, I think I have a headache or something is wrong with my chest. What do you think? Oh, no, I'm going to send you to Garki after my examination because this may be more important than you are thinking. You see, there's organization already. We lack that. Right. Anybody can wake up in Lagos and say, I'm going to Garki Hospital. Why? Why? So the sustainability of PPP is protecting us through a referral system. So you get those cases that you are best able to deal with, whereas other people deal with the other cases that you don't have to bother yourself about it. So I think, in summary, that advocacy, setting up a proper structure to do it, government's function being regulation and compliance monitoring, setting the standards that should be met, and then keep reviewing the results to know, what's going on. And then access must never be in dispute, and it must be through a formal referral channel.
In addition to this last point you mentioned, is the role of technology. We see a lot of telemedicines, as now the first point of care, replacing primary health care. Do you see telemedicine or technology like telemedicine services taking advantage or taking over physical primary healthcare visits?
I have no doubt about that. Why? Because there are robot doctors everywhere now, especially in China. The whole system, don't tell the doctors, probably more knowledgeable than us, more references, no bad emotion. It's not tired, it's not drunk. So he takes the human issues out. We're on to that. We will resist it for a while, but then we get used to it. How could you ever imagine that a photo can be sent from London to you in split second? How? Not in my time. Those days when we used to do and post it for 2 weeks before it gets there. What are you saying? It's here.
Right.
It's here. Telemedicine is the future.
Right.
And that's a one-on-one medicine rather than big establishments. Will it also surprise you that there will be telesurgery too, whereby operations are performed by doctors from far away?
I mean,
this thing will sustain.
Yeah.
This thing will sustain.
Right.
The biggest part of it is machines knowing how to perform operations better than man by themselves. And we just observe in case some madness comes in and says, stop! We take over from there. That's all. But as for who will be tomorrow's best surgeons? Machines. Who will be tomorrow's best doctors? Machines.
Thank you so much. This has been a most pleasant conversation, Dr. Wada, and thank you so much for your time.